Tapeworm infection. This is a parasitic infection caused by cystodes or tapeworms, characterized by passage of progrotids in stool, nausea, abdominal pain, and a headache. Alright, so talking about the risk factors or the predisposing factors to this condition, we have poor sanitation. So poor sanitation is one of the common predisposing factors to tapeworm infection. We have poor hygiene, so it could be poor hand hygiene or poor toilet hygiene. These predisposing factors to tapeworm infection. The other one is drinking contaminated water, happens to be a very common predisposing factor to this infection. Okay, and the other one is eating raw meat or uncooked meat or undercooked meat. This is common especially for tinnitus. Okay, those that like eating pork and meat, including fish. You or we are at a risk of having tapeworm infection, especially if the meat is undercooked. We are at a risk of having this condition. If we have poor pet flea control, that is a very common predisposing factor, especially some of us who happens to keep pets like dogs and cats. So the fleas of these pets, they carry the cysticercosis. So if we mistakenly happen to swallow any of those, we precipitate the infection. All right, so now we'll be talking about the species of tapeworm, and I will focus on a certain species of tapeworm infection that actually comes in GNC or General Nursing Council of Zambia exams. Is it okay? All right, so talking about the species of a tapeworm, we have Tinea saginata. So Tinea saginata is also known as beef tapeworm. I will get in details for that. We have Tinea cilium, also known as pork tapeworm. Also, I'll get in details. These are the species I will focus on. And the other one is Diphyllobothrium luteum or latum, also known as fish tapeworm. We have Hymenolupus nana, which is actually human to human contact or like auto infection within a human. And we have Dipylidium caninum. This is more like a flea tapeworm. It happens when you mistakenly swallow a flea infected with one of the gravid progrotids. Is it okay? All right, so look at the structure of a tapeworm. So a tapeworm has a head. So a head, this is where you find, or others they call it a scolex. So it has these suckers there. Okay, so it has a neck. Now the remaining segments, like they are more like certain compartments that are put together. That's how it looks like. So that's how it is actually, because the segmented structures happens to break off, especially the ones that are last, because those are the like mature progrotids. They are like gravid, or they carry the cysticercosis or the eggs, so that they can carry on the infection. So it is the same eggs that will be passed in the stool of either a human being or cattle. Is it making sense? So what usually happens is when you ingest either uncooked meat, or whether fish or drinking contaminated water or any of the predisposing factors we talked about. So I am focusing on the Tinea saginata or the Tinea cilium. The Diphyllobothrium luteum, I will just briefly mention a few things about it. Now, when we're talking about the Tinea saginata and the Tinea cilium, the tapeworm infection caused by these two, it is known as tiniasis. Okay, and that's our main focus. So now, what happens is that a human being eats either meat, okay, uncooked meat, infected, okay, or which contain the cysticercosis. So the cysticercosis are more like the mature cysts or the eggs of the tapeworm infection. Okay, now what happens is when you chew, or should we say you ingest these meat, the egg will be released into your gastrointestinal tract. So to be specific, it will be in your intestines. So remember I said that the scolex, which is the head of the tapeworm, has like suckers or the hooks like. So it attaches itself on the mucosa membrane of your GIT. You understand? These cysticercosis can be passed on in the blood, others will remain in the GIT. So it is from the same GIT that they begin to mature or to develop even further. So, like you have seen, the from the neck, we have the immature progrotids, then we have the gravid progrotids. So the gravid progrotids, they are the ones that are carrying the eggs. So in the point of infection, the tapeworm breaks off the progrotids in two. So remember, the gravid progrotids, they are carrying the eggs to carry on the infection, you understand? So when, let's say you defecate, let's say somewhere, then your stool was used as manure, then a pig or cattle, then it had to eat the same vegetation, okay, contaminated with the eggs. So when the eggs enter into the GIT, which is the alimentary canal, and when they reach the intestine, so the alkaline environment of the intestine is going to break off the shell of the egg. So the egg contains the onchosphere. So the onchosphere is where the cysticercosis is being kept in. Is it okay? So from there, once the cysticercosis are set free, they are going to hook to the walls of your intestines and then enter into the bloodstream. So others, they'll find themselves in organs like the liver, others they can find themselves in the eye, others they can even reach the brain. Okay, so for Tinea saginata, we are likely to find itself within the intestines, but for Tinea cilium, we are going to find it's widely disseminated throughout the body. Okay, so when it is widely disseminated throughout the body, it becomes cysticercosis. At that point, your immune system is likely to defend itself against this invading parasite. But when it reaches sites like the brain and the eyes, your immune system cannot defend itself. That's why when it reaches the brain, it becomes neurocysticercosis, where one can even have what we call acquired epilepsy. So they are going to show signs of convulsions, seizures, and confusions. Is it making sense? So if you want more details about neurocysticercosis, you can join my WhatsApp group so that we can explain this more in depth. So now let's concentrate on the same Tinea saginata and Tinea cilium. So remember, tapeworm infection caused by Tinea saginata and Tinea cilium, it's known as tiniasis. Is it making sense? So what are the clinical manifestations, or what are the signs and symptoms? So we have passage of progrotids in stool. So remember when I was explaining that the infection, the tapeworm is going to break off the gravid or the mature progrotids in stool to carry on the infection. So that's what happened. So now this tapeworm does not have intestines, so it just absorbs the nutrients. So due to the same, you end up going to have malnutrition. So you are going to have loss of weight. There's going to be nausea and vomiting because it is irritating your gastrointestinal system. Is it making sense? There is also going to be abdominal pain, especially colic pain, okay, like pain in the intestines. When it crosses over to the brain, the cysticercosis, when they are found to the brain, they are likely to cause seizures, headaches, and the like. So headache is a sign and symptom, especially if one has a neurocysticercosis. Is it making sense? Others are likely to have pain on the right hypochondriac region, especially if they've got cysticercosis, like presence of these cysticercosis in the liver and other organs. They are even likely to have anemia, okay, like vitamin B12 deficiency anemia. Okay, one is likely to have anemia due to the same. Is it okay? So the signs and symptoms are a lot of them. Is it okay? So you can just join the WhatsApp page and the WhatsApp group, and we explain in detail. All right, so we can talk about the management. How can we manage this condition? So for nursing students, don't forget to start with your M's. So M's are very important. Then write your investigation stroke diagnosis. You need to talk about your history, talk about the physical examination. You can even talk about stool specimen for analysis. Why are we doing that? We said that the tapeworm will carry on the infection through the progrotids, which are passed in stool, right? So the lab technicians are going to analyze the stool sample, and they're going to find the presence of these progrotids as a diagnostic feature. Is it making sense? You can even do serology tests. So now remember, your body's immune system has a way it responds to infection. So when there is a presence of parasites, a certain group of white blood cells will respond. So in this case, there will be mild eosinophilia, or presence of mild eosinophils. So eosinophils are the white blood cells that responds to parasitic invasion. You can even do CT scan, especially of the brain. So now CT scan, it's going to review presence of lesions caused by their cysticercosis. So why you are suspecting neurocysticercosis. So remember, we said that the cysticercosis can penetrate into your tissues. They can be transported through your blood to the brain. You understand? So now these cysticercosis can cause lesions to your brain. So on the signs and symptoms I talked about, they can cause one to start having fits or convulsions, or show some seizures. Is it okay? They can even show some psychotic symptoms like aggression, okay, is one of them. Depression is one of them. So if you send your patient for a CT scan, you are suspecting the same. So if there is presence of cysticercosis to the brain, it will reveal certain dense lesions on the brain when you read your CT scan. Is it okay? You can even do abdominal scan just to check if the liver is okay, if your intestine isn't, let's say your intestines aren't perforated. Is it making sense? So how can we treat? Is there medication we can give to treat this infection? Well, yeah. Okay, so we can give the following medication. All right, so albendazole, mebendazole, praziquantel, niclosamide. So we have praziquantel, niclosamide, and albendazole. They are like the recommended medication. You can even give vitamin B12 supplements. You can even give anti-epileptics.